Sorry, did you start it? Okay. Before I enter the room, I'm going to look at any recent changes in lab values or any new or needed orders that I need to pay attention to. I'm also going to look for any signs or flags on the door indicating a fall risk, that I need to bring in oxygen, or if I need to put on extra PPE for airborne or droplet precautions. And I don't see any signs on the door, so I'm free to go in. I'll knock the door. Hello? I'll do hand hygiene. Some hand hygiene over here. Hello there, my name is Sarah and I'll be your student nurse for today from 7 to 7 p.m. Can I first get your name and date of birth?
Cecilia Round Portal, September 14th, 2000.
Okay, thank you. And Cecilia, do you want to go by Cecilia or do you go by a different name?
You can call me Cece.
Cece? Okay. So what can I do for you today?
I'm here for a checkup for my knee.
Okay, which knee?
My left knee.
Your left knee? Okay. What happened to it?
I dislocated my kneecap about 2 weeks ago.
Shoot, I'm so sorry to hear that. Ouch. Okay. And how did you dislocate it?
I was running on an inflatable obstacle course.
Oh, okay. And you said this happened about 2 weeks ago?
Yep.
Okay. So I'm just going to assess your body and assess especially that knee that was dislocated for today. And if you have any questions, let me know, okay? All right. So for pain, are you using any medications or any icing or anything like that for your knee?
No medications, but I ice it if it gets sore.
Okay. And then does it get worse with movement or any type of motion?
Just if I go up and down stairs or if I'm on my feet all day.
Okay. Good to know. And then, does anything make it better or worse, the pain?
Just like resting it, but I can put all my weight on it now.
Okay. And where is the pain located?
It stays within like my kneecap region.
Okay. And does it kind of radiate into your foot and your the rest of your leg, or just stay in that area?
It stays there.
Stays in there. Okay. And how would you describe your pain?
It's like a sharp shooting pain.
Okay. And does it ever go away completely, or is it just kind of stay there?
It goes away.
It goes away. Okay. And then I have this pain scale here. It's not an actual real one, but I'm signifying it's the pain scale. So from a scale of 0 to 10, 0 being none at all and 10 being the most, how would you rate your pain now?
Right now it's 0.
0, okay. And how would you rate your pain from a scale of 0 to 10 when you did injure it?
A 6.
A 6, okay. Well, I'm sorry to hear that. So you dislocated it. I think I asked, the pain doesn't ever go away completely, or it does?
It does,
It does, okay. Well, good to know. We'll do some more assessment on that soon. Right now we're going to move on to appearance. So I'm just going to note your physical appearance. As for your facial expression, you look very alert, you look calm, you don't seem to be in any distress, and your expression is relaxed and appropriate for the situation. As for position in bed, you seem positioned nicely in good body alignment. You seem relaxed again and not anxious, which is good. As for hygiene, I don't smell any odor. You seem to have good, proper hygiene. You seem well groomed, which is good. For orientation, you seem very alert and responsive to what I say. For hearing, I haven't had to repeat myself at all, and you respond with the appropriate commands or responses, so I would assume you're hearing as well. And then as for verbal and speech, you seem to have a good, appropriate conversation, a good pattern of speech, and good articulation, so that's also good too. And then can I just assess your skin overall? Okay. Wonderful. Okay. So yeah, looking at the skin, I don't see any pallor or cyanosis, no lesions or blotchiness. You have the overall kind of tanned look, which is good. And you have some kind of pink tone as well, which could indicate good circulation, so that's good. And then as for alert and oriented, I'm going to ask you a few questions about that, okay? Okay, so what's my name?
Sarah.
Okay, and what time is it?
It's about 6 p.m.
You're right, okay. And then where are we right now?
The hospital.
Okay, So she's alert and oriented ×3 to person, place, and time. So that's really great. And then as for the Glasgow Coma Scale, as for vision, she's moving her eyes spontaneously. Do you have any pain with blinking or anything?
No.
Okay, and her eyes aren't shaking at all either, so that's the full points there. For motor, can I have you, I'm just gonna pull this blanket down again. Can I have you wiggle your hands and toes for me? Okay, perfect. So she has complete control of her hands, and yes, good purposeful movements there. Yeah, and obeys my commands, which is great. And then here, I'll cover you back up. And then as for verbal, again, like I said, she has good articulation, responds appropriately to my questions. So a good pattern of talking. So that's great. So I'll give her the full 15 points for the Glasgow Coma Scale. And then we'll move on to neurological, okay? Sounds good. Actually, we'll do vitals first, if that's all right. Okay. So let's start with pulse oximeter. So this is my pulse oximeter. I don't have one right now, so this is signifying it. And then we'll put it on your index finger. And we don't want to put it on the thumb because it has its own pulse. And then if there's any nail polish, I would take that off just because it gets in the way of the reading. Okay, so it's about 97%, and that's within the normal range of 95 to 100% oxygen saturation, so that is very good. Good to see. And then temperature, I don't have a thermometer on me either, so I'm going to pretend this is a tympanic thermometer that I'm going to place in the ear. Alright, so can I have you stand up actually? I mean sit. Sit's great too. Okay, I'm just going to sit here. And then I'm just going to pull the pin of the ear upward and insert the thermometer. If there's any pain, let me know because there shouldn't be any. Okay, and then once the reading is done, I'll read it, and it's 98.3, which is good. Doesn't indicate a fever. And then let's do blood pressure. How about? Do you have a specific blood pressure you usually get or normal reading? Okay. We will see today. Do you want a specific arm? Okay, let's do this one. Alright, so first I'm going to estimate the systolic. I'll put it right about here. You want it to be kind of snug but not too tight. And then if I could have you hold this with this hand, that'd be wonderful. Alright, and now I'm just going to find the brachial pulse, and I'm going to inflate it to about, well, I'd say 140, and try and estimate the systolic here. Okay. Okay, and I had it about 122, so that's the estimated systolic, and then I'll go ahead and use my stethoscope to get the blood pressure reading. And we would normally let the arm rest from the pressure for about 30 seconds before continuing. Alright, then I'm just going to put my diaphragm on there. Okay, here we go. And since it was 122, I said, I'm going to go 30 above that, so 152. Tighten it here. Okay, so I had about 116/76, and That is also within the normal range. Anything over 120 or 120 over 80 would be abnormal and kind of a worry. So this is a good reading. Thank you so much. Okay, and then let's do your apical pulse, okay? And the apical pulse is located on the left midclavicular line at the 5th intercostal space. And I'm gonna listen for a full minute. And could I actually look at your watch? Or you can keep it on if you want to. I just would. Okay, so I'm gonna go under your shirt, okay? And I'm not gonna lift up her shirt all the way because this will be posted on the internet. So for privacy, I'll go right under. And okay. Thank you very much, Cece. So I got a pulse of about 72, and that is good. That's within the normal range of 60 to 100. And I also counted respirations, and I counted 17 breaths per minute, and that's also within the normal range of 12 to 20. So all great vitals. Everything seems good there. So let's move on to a neuro exam, okay? All right. So first, I'm gonna have you take a sip of water, if that's okay. All right, and any pain with that? No pain. Okay. All right, and I'm just going to, I got a flashlight here. I'm just gonna look at your eyelids, and there seems to be no drooping of the upper eyelids, which is ptosis. And then can you smile for me? Great. Okay. And the edges of the lips rise symmetrically, so there's no facial droop, which is also great. And then I also lost my pupillary gauge, so this is going to be my gauge. So I'm going to compare the pupil size of each one, and I'm going to say it's about 5 millimeters with each pupil, and they're even bilaterally. So that's good, that's normal. And then I'll see if your eyes are reacting to light. Your pupils constrict, so just look straight ahead at me, and I'll bring the light over on each side. Okay. And the pupils constrict directly and consensually, and they're even bilaterally, so that is really great to see. Means you're not in shock, so good, great job there. Okay, and then if you'd like to lay back down for the rest of the neuro exam, you totally can. Sure. Okay, perfect. You doing okay? Okay. All right, so I'm just gonna assess your muscle reflexes, okay? All right, so I'm gonna have you squeeze my hands. All right, very strong, and then push or pull towards yourself, and then push away. Perfect. And I would give her 5+ muscle strength for that, since you're very strong. Do you experience any numbness or tingling in your toes or fingers? No. Okay. Can you wiggle your toes and fingers for me? Okay, great. And can you lift one leg and then the other? Perfect. Great job. Okay. Now can you push against me and then pull? Great job. Okay. And this is the leg that's hurting in here? Okay. Let me know if any of these exercises hurt it or aggravate it, okay? Alright, so I'm just going to do capillary refill of your toes. And since she does have nail polish in the medical setting, I would ask her to remove it first in order to see better capillary refill. All seems good there. Okay, good capillary refill there. And I'll also do the posterior tibial pulses. Yep, and that's 2+. They're even bilaterally normal. They're not bounding, so I would give it a 2+. And then for the other strength exercises, I would give them all 5+ for strength. Okay, and then the dorsalis pedis pulses. Okay, they're normal, they're strong, they're even bilaterally. So again, I would give that a 2+. And then can I see your fingers? We'll do capillary refill here. Okay. And again, like her toes, the capillaries refill within 3 seconds and pretty quickly turn a pinkish color, so that indicates good oxygenation there. So really great sign. And then we'll do your radial pulses, all right? Yep, and they're also strong and they're even bilaterally, so again, I would give that a 2+, okay? All right, now I'm just gonna assess your legs for edema, okay? So I'm gonna do tibial and see if there's any pitting when I release my hands. Yeah, there doesn't seem to be any. Was there any pain around that knee here?
No.
Okay, and I see no edema there, so I would give it a 0+ for the pitting scale. Okay, and again, no pitting there, so that's another 0+. And then as I go over the body, I'm assessing skin as well, and there doesn't seem to be any lesions. As for temperature, I'm just going to run my hands along your legs. Seems to be quite warm. Your toes are a little cooler, but that's normal. Again, no lesions, no redness, no swelling. I haven't seen any dressings. I haven't seen an IV site or anything like that. And if there were an IV site, I would assess the type of fluid being inserted and the rate at which it was, and if there was any swelling or skin breakdown around the area. Okay, and then can I feel the temperature of your hands? Oh, so there's even temperature bilaterally, and she's warm. She's not too warm, so that doesn't indicate a fever or anything. So that should be it for neurological. So that is great to see. And she seems very reactive. Okay, so let us move on to, we did muscular, let's move on to respiratory, okay? All right, and then can I have you sit back up if that's okay? All right, and do you have any difficulty breathing, any chest pain like that?
Nope.
Okay, and then I would also note if the breathing was labored or unlabored by looking at lung sounds and also seeing if there was accessory muscle use and things like that. But she doesn't seem to have any trouble breathing right now. If she were, I would kind of encourage the use of an incentive spirometer if it were ordered to help her breathe better and breathe more deeply and open those lungs up as much as she can. And then also implementing other breathing exercises too. She doesn't seem to have a oxygen mask on, but if she did, I would note the type of cannula, if it was placed correctly on your face, if the flow rate was correct, and make sure the tubes weren't kinked and things like that. Just taking note of that. And then, do you have a cough at all? No. Okay. Well, if you do, please let me know. I'd like to know kind of the if there was any mucus, and then amount, color, things like that, okay? Perfect. All right. So I'm just gonna listen to the lungs in about 6 different points anteriorly, and then 6 to 8 on the back, and then also 2 on the side. So I'll just have you inhale deeply and exhale every time I move the stethoscope. And if let me know if I should slow down too.
Okay.
Okay. Okay. And I'm moving in kind of a zigzag way down the lungs. Okay. And I'm going to go underneath, okay? To the accessory. Okay, perfect. And then I'm going to go ahead and do your back, okay? So if you could just scooch a little to the side, that'd be perfect. Okay. And then for the back, I'm also going in kind of a side to side vertical position down her back to make sure I hear every area. Okay, perfect. Thank you so much. And I was listening for any adventitious breath sounds, but everything seems clear. There's no wheezing, there's no crackles, nothing of that sort. So that is great. That's all clear. And then let's move on to cardiovascular, okay? So do you have any chest pain, any heart problems, anything like that? No? Okay. And then we went through circulation, we went through pulses, we went through edema already. So I'm just going to listen to your heart sounds now, okay? So I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and then mitral area of the heart. And then S2 is heard best at pulmonic, and S1 is heard best at the mitral area around the apex of the heart. So I'm just going to do it in that order, and I'm going to listen with my diaphragm and the bell of the stethoscope, and I'm going to listen for any heart murmurs, any bruits, any extra beats, skipped beats, anything out of the ordinary. So, and again, I'm going to keep her shirt on here and just go underneath. Okay, and I hear S2 there, better. And that's normal. And this is normal. I hear S2 best. And then Erb's point. And that's normal, and the noises are equal there. Okay. And then tricuspid. Tricuspid, I hear S1 better. And then mitral, finally, I hear S1 the best. And that's all normal sounds. And then I'll move to the diaphragm. And I'll be moving upwards, starting at the mitral, and then tricuspid. And then I'm going to go above, go to Erb's point, and then pulmonic, and then aortic. Perfect. Okay, so I didn't hear any heart murmurs, nothing like that. No extra heart sounds, no speeding up and slowing down. So that's great. There's nothing wrong there, which is great. And then can we move on to abdominal? Does that sound good? All right, yep, we can go ahead and lay back down. And I'm just gonna ask you a few questions about that. Do you have any pain in your abdomen ever?
No.
Okay, do you have any nausea?
No.
What is your diet like?
I would say well balanced.
Yeah. Okay. Are you eating plenty of fibers, vegetables, meats, fruits every day?
Yeah.
Okay. Good. Good. So she told me that she has a pretty nutritious meals, healthy diet. So we don't need to change her diet in any way and make any plans for that. So that's great. And then for if she had an ostomy bag, some sort of tube drainage or a GI tube, I would assess that and assess the drainage, making sure it was coming out appropriately. And if she did have a stoma on too, I'd make sure that the stoma was a nice pink red and there wasn't anything abnormal about it. So make sure that happens. And then also, as for bowel movements, do you pretty regularly have bowel movements?
About twice a day.
Twice a day? Okay. And what's the color like?
Brown.
Okay, and what's the character of your BMs about?
Pretty soft.
Pretty soft? Okay. And do you have any pain?
No.
With that? Okay, good. So she doesn't show any indications of constipation or any abdominal issues. And are you allergic to anything either?
No.
No. Okay. All right. So I'm just gonna assess your stomach. Is it okay if I pull your shirt up slightly? Yeah. Okay. And I'm just gonna feel for temperature. Yep. And then right off the bat, her stomach feels nice and warm, which is good. And then color-wise, it's a little bit lighter than the rest of her body, which is normal. But there aren't any lesions or swelling or anything like that, so that's really good. And then it seems to be quite a flat stomach. There's no distension. There doesn't look to be any areas of protrusion of anything indicating a hernia, so it's all good there. And then we'll go ahead and auscultate, okay? And I'm going to start in the right lower quadrant and move clockwise. Switch it there. All right, here we go. Sorry if it's a little cold. Okay. All right. And I can hear those bowel sounds in every quadrant. Seems to be normal active. There's no sign of no sounds. So there's good movement. It seems like everything's working within your GI system, which is great. Okay, so I'm just gonna go ahead and do some light palpation on your stomach. Okay, you let me know if there's any tenderness there. Okay. And I'm just going in circular motions, kind of around the belly button area. Just circling around, looking for any areas of firmness, distension, tenderness. Do you feel any pain anywhere? No. Okay, so from palpating the stomach, it seems that there's no areas of firmness or tenderness, which could possibly indicate a hernia or constipation or something like that. And CC does not have any of those symptoms, so that is good. And we can move on here. So can I ask a little bit about urinary? So how frequently do you urinate?
Probably like 4 times a day.
Okay, and then about how much would you say you urinate?
Probably like half a cup to a cup.
Each, yeah.
Mm-hmm.
Okay, and then as for color, what does it look like?
Like light yellow.
Okay, and then clarity, is it clear or is it cloudy or?
It's clear. Yeah.
Okay, and then do you have any pain or burning with urination either?
No.
Okay, so if she did have any sort of like pain or burning down there with urination, that could indicate a possible urinary tract infection. So that's why we ask about that. And her urine is not cloudy either, so that is also a good thing. It indicates that there's no stasis of the urine, there's no excess vitamins or infection or bacteria, so that's all great. And then if she had a catheter, I would like to make note of its position. If any of the tubes were kinked, I would make sure they were unkinked, see if the catheter bag needs to be changed and things like that, and just check the patency of the catheter. And then if I suspected kind of urinary retention, I would go ahead with a bladder scanner to see how much urine was staying in the bladder and see if we could take you to the bathroom or something to eliminate that. But everything seems fine on that front, which is great. So we can go ahead and talk about your skin a little more, if that's okay. Okay, so I'm just gonna assess your skin turgor on your forearm, okay? That's great, thank you. So I'm just gonna pinch part of the forearm, and then it should spring right back in place. There's no tenting, which is a good indicator that she's properly hydrated. So that's really great. I assessed for edema, I assessed kind of skin temperature and things like that. And then I'm just gonna assess this area for any loss of sensation, numbness or tingling around the injured area. So I'm just gonna lightly touch it, okay? And then where am I touching here?
The top of my knee.
Okay, and then here?
The left side.
Okay, and here? The right side. Perfect. I'm just gonna palpate it lightly, okay? Any pain with that?
No.
No? Okay, great. And then also for skin, if she is immobile in bed, I would like to try a Braden skin ulcer assessment on that, and that has to do with immobility, friction and shear, moisture, a nutritional deficit, sensory perception deficit, and anything like that surrounding immobility. And she's not immobile right now, so I can score her very low for that. And then if you were in bed, bedridden, we would like to implement a turning schedule just to stay off those bony prominences and prevent skin ulcers as well. And if you did have kind of a pressurized bed, either air-filled or fluid-filled, I'd like to make sure that that's working properly by looking at the settings, and otherwise that could lead to more possible skin breakdown. And then as for mobility, are you able to walk and run as you used to, or?
I can walk, running. I have to still go easy on it. But
Okay,
yeah.
okay, good to know. All right. And then are you able to take yourself to the bathroom and things like that too? And then do you use any assistive devices?
Just when I wear a knee brace when I work out, but that's
okay. Okay. And then we don't have any SCDs, TEDs, or any sort of foot pumps, but if she did, I would just make sure that they were working properly, and just check their settings, make sure they're working. And then as for fall risk, I would use the normal fall risk assessment if you were on any medications that would cause confusion, like opioids, things like that. If you had a decreased level of consciousness, more immobility, sensory perception deficit, change in mental status, something like that. Or if she has an IV heparin lock that's kind of connecting her to something near the bed, that's also a fall risk. And if she's fallen before too, I would also like to make note of that. Other than that, I believe that should be it. Is there anything else I can get you?
nope, I'm good.
No, that's great. Okay. Well, your call light, this is going to signify the call light. So I'll just leave this in your hand. I'll make sure the bed is at a low position. I'm going to make sure that your head is properly upwards. And again, if you were bedridden, I would like to note her position in bed, and make sure that she had good body alignment, that the head of the bed was up correctly, to kind of make sure friction and shear wasn't happening as much. And then other than that, a turning schedule, things like that. Yeah, so I can head out here, I think. Thank you so much for your time. Do you want your side rails up for safety?
Sure.
Here? Okay, up, side rails up, bed is low, bed is locked, and your head of the bed is a little bit upwards, but nothing crazy. And then I will be out of your hair here. I hope to see you later soon, okay?
Thank you.
All right, and I'll do hand hygiene on my way out. And that's it.